யாரும் வரலன்னாங்க. சரிம்மா பரவாயில்ல, அதை விட்டு பரவாயில்ல. வர சொல்லுமா இங்கே பக்கத்துல வர சொல்லுங்க. வாங்க தம்பி. ஹலோ வாங்க, உட்காருங்க தம்பி, வாங்க உட்காருங்க. Dear friends, we have so far finished 874 cases of Puberphonia. So I am so happy to go forward with our research activity also. So today we are having an important guest who will be able to tell us how to reach globally. So he is helping me a lot for so many years, I can say. He is actually, I met him for 28. Today is 28th May 2022. So I just want to introduce my friend because he will take it forward, the Puberphonia, and very enterprising gentleman who has done a lot of work on virtual reality, and now he is actually doing a work more on internet and how to spread the messages globally. Okay, I come further. மேல அந்த ஸ்கிரீனை கொஞ்சம் போட்டிருப்போம், அது பிளாக் ஆகுது. ஒரு உங்க பயோடேட்டா பற்றி கொஞ்சம் சொல்லுங்க தம்பி. And in what way you are connected with me also, only for 15 minutes. Okay, tell about you and your activity so far. கதவை திறந்துட்டு அடைச்சிட்டா அதுல நின்றுவிடும். Tell me your name and your experience in virtual reality, and your now today also I am so happy, Dr. Mangama, looking forward, do some work on this virtual world, because she is interested in treating cancer breast and discharge in uterine discharges and other thing, and many other social problem also. Now she is aiming to spread this universally through YouTube or
Yes.
multimedia.
Yeah.
Sir, kindly tell your name, your phone, your address, and your activity and your achievement, please.
So myself, Satish. So I have been interacting with doctor and getting his valuable views on using technology for introducing the usage of technologies in medical field for arriving a better solution which helps this society and world in a better way. Because you everybody know about doctor and his profile. He has excellent career track records and his achievements on Puberphonia. So I have been involved with him for addressing a serious issue called autism. So that time we collaborated with doctor by eradicating the autism through give cognitive training for the children to improve their lifestyles using virtual reality. So doctor has given so many significant inputs for usage of that technology, and we tried a lot for helping those people to get normalized, and they are also to be treated as a human, and they should become as a normal one, because they usually fond of animated and social animated kind of characters. So we tried POC kind of activities in engaging with Department of Disability, which is run by government of Tamil Nadu. So in such scenario, we both discussed on more arena and how technology can be leveraged to help this society. As you are know, doctor is more on puberphonia and those related of treatments. He is deriving solutions and treatment methods from ancient our literature and collaborating with the modern technology and as well as modern medicinal methods which are all globally in practice. So he is expert in all kind of areas. So he always contributed this society a lot. We are just trying to help him through our technological skills for improving the medication methods and as well as promoting him to the next level. So I would not say it as a promotion. The right thing should reach the needy people, so that only this cycle will get closed. So that's what I try. I'm interested to share with you, friends.
Okay, we tried a lot of things in virtual reality. It is going in a wrong, correct direction only. But the cost factor is so much
Yeah.
involved. That's what I feel. And the technical expertise is required more. See, we can say doctors can treat, but uh, you, Satish, as a computer man, computer scientist, each needs a lot of energy and time consuming work for you. Now, I just want to spread this Puberphonia globally because we know that all over the world they are aiming to treat it in various methods. In our standard, we want to do it in a non-invasive procedure. You know it very well that Japanese are very much interested and enthusiastic in treating Puberphonia because that population only there, you know, that population means Eastern world. Dubai, they are not Dubai, this Thailand, Hong Kong, and the surrounding area, more of this Puberphonia is there. You know, there the lady boys are there, and Taiwan. So, one Japan surgeon, Isuki, he has found out one method of surgical correction of vocal cord. This is world famous, everybody is doing, I have done it. But in my hand, I have done more cases. That surgical procedure is good. Surgery on the vocal cord, reducing the length of the vocal cord. Now, we found out a better method of non-invasive procedure called as non-surgical, no medicine required. Because of the ventilation, we can achieve it to a correct direction. This is you. This is old idea of Indian or Tamil culture. You know, our king had conquered Eastern world. How they conquered mean they went in through the sea. They crossed the sea without any difficulty. How they traveled is they follow the direction of the wind. Even in my village, they used to tell in Malaysia or even Indonesia, teak, they will cut it and place it in the sea. It directly will come to Tamil.
Yeah, from Burma, I heard these stories.
You also know that.
Yeah.
So, though no transportation is required. So similarly, only our king had found out how to go to the eastern world and conquer it by boat itself. Without much technical advancement, they will be able to assess the wind flow, water flow, everything. They conquered. I'm so happy. You also hear that the tea coat from that countries and transported to Tamil Nadu. Tamil Nadu means at that time, from the history we are knowing, the whole India is one land where most of the people are talking in Tamil language. It is not a separate country at all. This is a continent.
Yeah.
Where our kingdom, they may be ruled all the places because we know the history is little more changing and I think whatever may be. So Burma teak, you hear
Yes.
that Burma teak, they just harvest it and place it in the sea, it will come directly to India. What a wonder, sir. Huh? So the same technology we are following to treat puberphonia. So it is a non-invasive procedure. It will be all right. So no much cost involved, no damage to the structures. That is the main thing. See, nowadays the plastic surgery so good, happy, great. But after a few years, if you do any plastic surgery, there is a contracture is there. Sinkage of the muscles or tissue will happen. If you cut anything, it will be all right, but the scar formation, healing. So that problem, so we cannot guarantee for a good voice permanently after a surgical treatment. Definitely it is good, it is giving a life, it is giving a immediate cure. But so we thought of doing it. Now with Satish, I want his great help. How to see everybody in the medical field, you know, India or Chennai is a hub of healthcare. So, in what way, your phone number, everything, tell, because we will finish it by 5:30. After that, we'll have a personal discussion. Okay? So, your number, in what way you feel you will be helpful for medical fraternity in spreading the message globally in achieving the patient transportation and other facilities we can offer globally in this era. Kindly tell, brother, what is your achievement so far? Because, see, your achievement, I know, you tried for autism and this is going on. And you have created your own technique of sanitizing our body, our hands while entering into the office. So there are so many methods are there. See, olden days they used to tap the bottle and get the Savlon or disinfectant and clean it. But you got your own idea and you have given to many of the office and they are happy and everything. Slowly, we have to go globally and a better method. So, what are your approaches for helping a doctor, especially puberphonia? You kindly tell, brother.
So in this era, we can say it as a era of artificial intelligence, which means
Great.
processing the huge volume of data for making the decision and analyzing the data for helping the doctors to treat the patients in a better way, and as well as the patients to make them aware of getting diagnosed and getting treated on time with exact disease or else the symptoms, so which will be more helpful for the people in the region and as well as the globally, and leverage this solution in an effective way. So patterns of diseases and symptoms. So I would like to say about this COVID-19. In such cases, we can record the uh, symptoms and what age group, gender, location. We can get these data and analyze the patterns and symptoms. So accordingly, it can be applied to the other patients too in the same region. So this is, I am just saying this as an so like this, we can apply this for puberphonia too. So so before 2 years, I used to come here for this hospital. Uh, there, doctor was using Android phone for recording the voice of the patient who is coming and getting puberphonia treatment. So that time he used to measure the frequency as data. So there are some threshold upper and lower limit values. So for male and female voices, typical male and female voice will be in a standard pitch and as well as frequency. So before giving his customized approach for treating this puberphonia, he used to record the data of frequency whatever the patient is having. So he used to give some procedures that should be followed in a routine for getting rid out of from the puberphonic diseases. So before and after, and following the treatment after in a long term, we can analyze these kind of data based on age group, gender, and location. It will be helpful for the other patients too, and it will help the doctor also to tune or tweak this method of treating for achieving the exact frequency. Because for an example, I would like to say, if a person is having I don't know about the exact medical related data. Just for an example, if a person is coming with a frequency of 10 hertz, which is female tone, yeah.
I just want to interrupt that female, it will be high frequency, say
Okay.
300, okay, and male, it is 100 to 200, okay, that is the thing, okay. In children, it is 400 frequency, okay.
Yeah.
Tell me, brother.
So, as of today, doctor has successfully treated 874 patients. So, if we are having the frequency level data in each phase of treatment, the progress, improvement, and where the age group and gender wise the difficulties faced by the puberphonic patients analyzed in a better way for improving this method of treatment. This will be helpful for the other doctors and other patients who are all suffering from this kind of puberphonic diseases. So the importance of data and yeah.
So, with your capacity, my feeling, village, if you are able to give an Android phone, everything, everybody can note their own frequency and send to you.
Yeah.
If you are having, they are having a small doubt, we are not able to fit for a speaking in a platform. Our voice is not like Amitabh Bachchan. So our voice should be improved. You can guide them, and what type of voice you will get it later also, you can give an idea to them. Is it possible?
Yeah. So their progress and as well as how they are getting improvised. So as you said in the first part, we can they can self test, self evaluate them for their voice, whether it is in the right pitch, whether they are in need of any treatments from doctor for to improve their social skills and removing their inferiority complexes. So which are all caused due to this puberphonia. So the first step is to treatment, how they are getting progressed throughout the this life cycle of getting recovered from puberphonia to a normal voice. And after that also, if they are having any doubts whether their voice is still they got stuck in the same place even after the treatment, if they are having any doubts, they can able to cross check. So in the other way, it will be helpful for us also to monitor them from remote itself. It can be done in a periodic way. We can monitor their voice. We can ask them to upload the voice note on app. The app will evaluate and send us the frequency, and then we can just send them a notification that you are becoming normal. Now you have become normal. You can lead your as whatever you aspired, whether you want to become a public speaker or a teacher, these kind of roles, because they were hesitant before getting the treatment, right? So that is why
Yes.
they are approaching you for treating in to change their voice to their gender.
Okay, not only like that, I am afraid facing a that is a very common thing. Whether, see, nowadays you will get a good job as a jackie or you can be a moderator. See, now work from home, earn money. That means you will be given an assignment. You approach 1,000 people and get satisfied that our product. Similarly, assess their voice. If they are having the problem, refer. That will give a revenue for them. After all, anyone needs treatment, they are willing to pay. So this is the first step. I hope so.
Yeah.
And your idea of evaluation of the thing, if it goes village by village, home by home, so we can easily pick out who are all having the problem and what is the assessment. See, many people want to become singer, many people want to become actors, many people want to become mimicry artists or receptionist or anchor for a show. So this is the thing. And I know many anchors to the TV, they have come from radios, radio station. Their voice will be more attractive. So immediately the TV owners, so think of that girl, the voice is good. That boy, the voice is good. So they take them to the TV show. And not only like that, every day lot of programs are going on in the city or town or villages. One anchor is required. So that thing, who is capable of doing that? So the voice is a very important thing. And you know that very well. The appearance also great, but appearance can be changed by doing a little cosmetic and a little makeup. But the voice, that will pick up. And moreover, many places the anchor will be inside the room. Nobody will know who is doing it, but they will give the comment. So this, I personally feel, you will be a great help for doctors in assessing, or evaluating their problems from sitting in the home itself.
Yeah.
See, in Puberphonia, my problem is in the house, they are going on hearing the same voice of a boy from birth to adulthood. So the father and mother, they still believe your voice is normal, good, good. See, our boys who came to treatment for me, by phone call, they recognize them as ladies. Dr. Armuham is there, Uma Maheshwari is there, and many more people, Bhattabarmal is there. So many more people are listening. Last Saturday, there are 75 people who are listening our video talk. So the same 75 people and more will be there. So now with Satish, the great computer engineer, more than that, artificially intelligent gentleman. See, myself, Now I want to, anybody want to recognize me not as a ENT surgeon, Puberphonia doctor. I like that. Kichikural doctor. Even last week, one interview, I just want to ask them to put as a Puberphonia doctor. In Tamil, it is a Kichikural doctor. But the editor told, oh, it looked like that, so a little different. And let it be different. We will be with the public. See, why I am telling is, father and mother failed to understand the feeling of Puberphonia boys. So, how can this boy will go and tell that girl had told me, are you a potay? Your voice is a childish or girl like that. Are you having energy for marriage? This boy will upset. He cannot go and tell mother and father that girl is asking whether I am having the power of marriage, or he cannot go and tell. He will simply tell, my voice is puberphonic, that's all. So, if a caliber is there which calculate and tell you are now a mature man, you had passed the child to the adult stage. Now your voice should break. There is some problem in breaking the voice. So this should be proved to the father and mother first. Because why I am going on insisting that means there is no anatomical problem for them. Only Satish, with his mission, he will be able to tell father, see, still I am having higher frequency, like a child, like a girl. It should be changed to a male character. That's what I am requiring. Then only I will be able to face the interview. I will be able to be an anchor. Or else all will laugh at us only to an interview. So this is a basic, a self-evaluation. So they themselves can do it, because nowadays everybody is attending college. Our government also trying, there should not be a dropout at all. So in that category, we should stand as first. So self-evaluation. So you want to know, now all are having Android cell phone. So how do you are going to spread the message? You can record the voice. So what is the process you feel like better?
So it is general typical method only. So it will not require any additional special infrastructure for recording their voice.
No, your work is more, because they have to record it and send to you, and you have to answer. You have to automatically answer and register them and pass on the message to the doctor, and they should be convinced.
Yes.
Because the world is not convinced. That is the main problem. So what more we can, is it a big process? See, I know you are doing lot of work on our metro channel also. Train. How it is, everything is automatically, I think you are
Yeah.
doing part of it. See how it reaches next station, and what is the time interval required, what is the next station. Now everything is measured. Everything is, see, olden days I used to hear in the flight, when it is nearing the airport, the pilot is having no place to operate. The man sitting in the airport will operate and bring the flight down, which area it has to be landed, which speed, which platform, so it correctly come and land. It is not, this is what I learned, not by the pilot, but as soon as it reaches the area of the airport, it is handled by the local gentleman. So similarly, so you should be an anchor for that. I pray we have to work a lot and create a little awareness. So this may be a pioneer work also. So yeah, I am insisting our artificial intelligence researcher that we have to approach village level and every level, because this puberphonia is a not only voice problem. Because of their voice, it is having a social problem. Olden days, now also, it is given in many and most of the literature. It is a psychological problem. Correct the psychology. It is a mental problem. So correct it, counsel it. But the basic problem is there. It has to be, the voice should be changed, and secondarily only they develop this mental upset and everything. So if an adult boy of 20 years, he is upset not reaching the public, but father and mother feel, oh, he had become mature, then only, so that's why he is always in the room and not with friends, not going out, because it is a stage of development stage, they say. It is a stage of depression for them. Books are written, they are afraid of becoming adulthood, because the whole father responsibility will be with the boy. That is why they are afraid of it. So they'll be after some, when they become mature, they'll be always alone. But this boy is afraid of going out because will be insulted by his voice. When voice is broken as hello, I'm happy, then he'll be a king and he'll try to rule the world. That's what required. So that is not there. That we have to create Satish. Okay.
Yeah.
So we have to plan for it. You are also another engineer working in that process.
Yeah.
What way you are interested, brother?
Yeah, we are working the same
Same thing.
Yeah.
Okay. So I pray God that we have to do a lot of work, and definitely we will be cooperating with the Satish in this matter, and we have to take it seriously, because this is a good opportunity for us, because the world is moving in a different direction. We have to accept that technology and go with that. We cannot go on still thinking manpower, we have to go and find out that this is not possible at all. The technology should move forward, because by the grace of God, everybody, every villages, we are having internet connection, and most of the places, even hotel, shops, hi-fi is free, something like that. Railway station, it is free. Even bus stand, it is free. So there is a great opportunity for us. We have to move with that, and we have to do that. What is your new thing, and tell your address and phone number, brother?
So this time we came up with a new approach for providing medical services in a different way. So how we are planning is to have a medical platform which will be helpful for the patients to afford the medical related services or diagnostic related services from their home itself. So we are working on that. So I'm going to discuss with doctor on further things. So how it can be effectively implemented, and what are all the challenges would be we facing while we are touching the surface. So we are expecting for good things to serve for this society.
Okay, so just tell your phone number, brother.
So my contact number is 8056 300 408.
So you are available on all days for any call,
Yeah.
and more than 70 people are there, so they will be able to call you, and their need may be in different direction. Okay, each doctor, each person, their way may be different. Okay, so now it is 5:30. We really enjoyed. Thank you very much. Great. We'll meet next Saturday. Thanking you. Thanking you. Thank you.
Thank you.